Good afternoon. My name is Marcello Benatti with Microsoft, and today I'm here to talk to you about healthcare analytics using the Microsoft Business Intelligence Stack. First of all, I always get this question. I'm presenting this on my Surface Professional, Surface Pro 3, and to show the power and the portability of the BI platform and the stack. One of the big things we always ask when folks are presenting on BI, on business intelligence, and specifically more the area of analytics, is who's your audience? What are they looking at? What kind of information are they trying to get? What kind of insights are they trying to garnish? For this purpose, we've taken the BI stack, which we currently host. This website is a SharePoint site hosted in our Microsoft Cloud, Azure, and we're focusing for clients in the healthcare and analytics part. As you get in, you can see right off the bat, the look and feel is a little different than the traditional SharePoint. We've leveraged the products that you see below here to create this presentation. We leverage cascading style sheets to give a more appealing visual representation of the analytics. For this purposes, we're targeting hospital administrators or a hospital group facility, but you can take data and information from any of your systems that exist in place and present it in this way. The presentation layer is SharePoint and PowerView. So as we log into here, there is a few key tags, and those are basically web parts that lead you to different power reports within the representation. We just represented in here so that you could see in a graphical interface as a login, as a main site, as your landing page, what kind of things you would like to do. From this BI analytics standpoint, we always like to see what folks are doing when they are, what kind of information they're looking for. So the first thing we look for, if you're a patient, the first keystone is to do no harm, but they want to see how information is presented, and we have patient statistics. This data sets, I've taken data sets from public available sources, and I'll show you how to get to those data sources by utilizing Power Query and Power Pivot on a later session. But for the purposes of this demo, I'm just going to showcase some of the information we've already collected and presented. There are three ways of looking at BI. You got the people that are going to collect and aggregate the data and massage it, make sure that it's presented and makes sense. Those are your power users. The people that are going to be digesting and making the analysis and presenting facts or information related to the data that was collected by the previous folks. And then the end user, the folks that finally look at the data, and it has to have some meaning and representation for that particular area. Just as I click through in here, we have a new dashboard filled with information pertinent to patient demographic and comparisons. I am going to click the full size mode, gives you the full ability and show that you're on the cloud, and you can select your filters. For this particular client, they wanted to select age, so we're selecting patients' age range from the 60s to the 70s. And the key metrics or the key performance indicators are the average charge amount, the number of patient encounters they've had, which clinic that they looked at, for example, the burn clinic, the cancer prevention, the emergency room visits. So we see this particular hospital has a lot of emergency rooms, which sometimes usually leads to a lot of radiology. Seniors fall, they have possible injuries that are related, they need x-rays. So you see the metrics associated to this particular scenarios. The average charge amount, and the average patient encounters, again, coming up in terms of from this certain period of timeline. The interesting part about this particular report with patient comparison is, and this is something that you always have to work with your end users, is navigation that they're familiar in interface. For this particular presentation, we've selected a navigation that enables you, the analyst, for a specific area to look at in depth of that report by selecting graphs in a visual representation. These links you can make them as links, you can put a matrix or spreadsheet, but I find that people looking at analytics, they like to see the charts and they have a meaning and representation. So we navigate through this particular visual interface by selecting. And once you select one of them, you can have the different selection of the graphic that's presented to you. That experience is very portable when you're talking about a tablet, and if we're doing Power BI, which leverages HTML5, you can bring the portability to non-Microsoft based devices such as the iPad or an Android type device. So overall patient distribution, we're looking at the hospital in here, we look at the sizes, and over period of times and age and distribution. This particular hospital, if you look at the distribution of this particular hospital chain, you can see the biggest concentration of patients fall within the 50 to 60 year of age category. We break it down even further, and different hospitals collect different types of information about the patients that make up their information. So we've created a comparison. So if you want to see again, patients we looked at before, we have patients in the 50s, and we're again pivoting on real life data, and patients in the 60s are some of the biggest numbers. So we want to see the types of procedures and what they're doing and what are the biggest charges. Coming back to the previous fact, we saw the majority of patients, we have 2,205 patients have come in into the emergency room procedures. There's a lot of procedure, and a large number of them have had thoracic surgery. So it's interesting to see what the scenario comparisons are. You can filter by demographic information and psychodemographic information, as well as religion, to see what kind of services they might need or the information that they will. Marital status, the gender, the age. And let's take a look at how many married single folks here. We're looking at folks in their 50s. And let's look at, and we have males and females. Let's look at how many single males are coming in and what that does to the chart. So you can, to make it simple, you can look at the data and simplify and filter as many of the data filter needs that you have within the group. Coming back to the main line, we again have a different simple navigation interface. The technology that's used in here, because we're using technology you already know, it makes it simple for you to take and edit those reports and those data numbers. And I'll just do it here so you can see, for the benefits of this, you can change the styles by changing color and background and information, so forth. Or you can take a look at the data and make changes to it and put your own styles and background. I'm not going to be making a lot of design changes to the report. You can change the priority by which reports are presented, whether first, second, or third, front or back, or a combination of a whole bunch of those. And you can also take a look at the fields which make up and which are represented by your data. So if you're not a database person or a power use, this is completely unnecessary. You can set this parameters to never be seen. So your end users may never be able to make those changes. For the users that you have more power and understand what the data represents, you can actually enable them to look at this and filter almost to an ad hoc and add elements to the report to create their specialized reports, finding information that's pertinent to what they want to do. So that's an important aspect. I'm going to exit it here. And again, we're using PowerView. You can save this. You can take this and export to PowerPoint. So if I take this graph and I want to embed into a PowerPoint presentation that I'm doing for a board or to an insurance review board, I'm able to take that information data in a visual representation and export it directly to any of those different devices. As well as I can share and deliver that information to end users across a variety of devices. Depending on the sharing level that you have, if they are members of your organization, they're able to dig through and view the data if they have permission to the data. If they're externalized users, you can embed data within a model and they can see only the data and not on the outside. That works pretty well on different cases. I am leaving the page. I made a choice without making any changes. And we're now jumping onto another tab, another situation where we want to analyze the background. This particular scenario is physician rankings. And we, as a hospital administrator, as healthcare providers, we want to see how our physicians are doing. And of course, we want to see the profitability. So the financial group within this hospital group wants to see what kind of profitability is associated to each type of doctors and where they're losing money. So if you look here, Ruben here is not doing very well in terms of his numbers and metrics in here. Not here to judge anybody. We're just giving a performance of the data. We also have a lot of hospitals have a lot of surgical delay, booking their rooms, back and forth information, and they want to see in-depth data about how much does that cost. So we can take a look at a particular hospital and a particular department and see how much that data is causing them. So the data is coming back and forth directly from the data model, and we've used this, we've selected a hospital, and we selected a particular department, and we can see by the doctors the average delay and how it correlates to the attending doctor and the profitability of the hospital. It's an interesting metric for doctors to see scheduling of patients as well as nurses on staff, emergency room personnel when they need, how much a delay of a procedure will cost in terms of HR cost, people that you need, attending physicians, anestheticians, and all the radiology folks that are pertinent. It's a metric that a lot of hospitals ignore, but believe it or not, has a lot of impact to their bottom line of finance. Another one that we've done too is the top procedure. So let's look at here for cardiologists and the departments, and the total procedures done by the physician and the classification of the procedure. So we have those are cardiological information, and as you go over each one of those KPIs or the key performance indicators, you can see the number of procedures and how they're affected. I've left the filters in here so you can take and make changes, and you can change this chart to present it into different locations. Those are the attending physicians that you have. You can select the data and filter it down by individual physician, the number of procedures, the profitability rank, and so forth. I'm not doing that for the purpose of the demo. And we're closing this back here. Again, we selected the user navigation interface that lends itself well for somebody on a tablet as well as on a desktop. So I'm using a tablet, but I'm using it in desktop mode and doing this presentation. We also broke it down where we have a holistic view of top positions, profitability by procedure, and we have the numbers associated to each one of those procedures and the profit associated to each one of those areas. We'll come back to the top line site. And again, I'm just showing this how it enables you to create and control the navigational interface for the analytics of the data that you already have. So the next element we're looking at is profitability. And we have 3 reports over this profitability site. Remember the navigational elements that we've addressed before. We can kick in and look at any of those information because the data is not yet rendered. As I hover over each and every one of those, I'm having problems with the hover word, not hover. It's filtered. I chose not to select the view because it may have confidential information, patient demographics. So you can select, there's a lot of power within the controls of those presentation layer that you can see or not see the information. And depending on your level of access, you are able to view or not view the information. Coming back to full screen mode. Again, you're given the warning because I'm in a cloud situation. I can see the surgical delay and profitability, and I've embedded the average surgical delay. Remember, we looked at that particular report. We look at the average profit and the cases by attending physical doc, MD. As I click on those, I can see a trend line over time. So we have profit on one axis and the timeline on the other, and you can see what the trend particular are. And operations are done and which areas are costing most, the average profit area, the number of cases, and which areas they're coming into vogue. This is again the attending doctor profitability. And another one, the payer profitability. Believe it or not, there's different types of payees that they're referenced. So if you have a lot of bad debt, payments that they don't have money, commercial, managed care, Medicaid, Medicare, residual self-pay, true self-pay, or workers' compensations. And you can select this by filters. You can look at the filters. I've done them by the hospital symbols. It's just graphical interface. You select an image, a JPEG or GIF, or you can save it as, and you can use your customized logos to use the navigation. So if you're creating a presentation for a hospital and you have a group of hospitals, you have your colors and fonts, those can be configured, colors, fonts, backgrounds, cascading style sheets, and logos to keep and maintain your corporate presence. And the filters are familiar to those guys. So hepatology or the name of a hospital or a particular logo will be able to be presented in this way, and you can make that within the logo and select it as a filter. You can also look at by year and filter it down. And for the purposes of this, and you can select multiple. If I can go back, you can see I can select over a period of 6 years. You see the profitability on that information. Hitting escape to go back. look at a breakdown of hospitals and clinics. And we'll load in the real life data feed. And we'll look at an entire regional representation. And when we come back to full screen, this is data overlaid using a technology called Power Maps, and it's overlaid on top of Bing Maps. So data physical represented and presented on that one. And the filter, the most common diagnosis, the most common patient insurance, and the location of the payment information. It's interesting when you start plotting types of injuries per location, and then we've done the same thing. We enable you to do the same thing with states, where we've taken the map, United States geographical survey maps, the formal characteristics, and you select the states and all the pertinent information down to that level. See, I always down to the street level, and you can go and maximize or minimize the map as you deem appropriate. And you can go this to up to a million rows of data for specific information that you're getting into. And last, we also have insurance, payee, details and information on insurance and healthcare providers, which are the ones that pay on time, the length of our average pay. Sometimes a client has a procedure, and depending, let's look at the full screen version of this one. As you can see, every time that I go into full screen mode, I chose to warn my end user to press escape to come back to where he was. This is a question of selection. You can tell them press back key or escape, so it shows them how to navigate and not get themselves lost. So for this particular report, we looked at age versus diagnosis and average charges of this particular ones, and we put it over metrics of time, the amount of patient encounters, and the locations of hospitals. So we looked at Blue Cross, CMS, Medicare. You can see those are very different depending on the workers' compensation. There's a lot of ones in here happening without medical complications. And then we had whether or not there were emergency visits or they were surgical interventions, which are caused by some of the other metrics. Very interesting information when you look at a map, and we just position them over the type of insurance payee, and each one of those circles basically represents the size and the color of the other information on positive or negative. And if you're looking at the types of services you're dealing with, you can see how the payments and metrics change per location or pay per insurance provider. And last but not least, we also have the charges and length of stay by state. As we see information with like regulatory and different things, you want to make sure that the patient stay is optimized, and so that there's cure, so that it doesn't come back, or that you don't have an early departure and have to come back and consequential charges. And now with the new regulatory changes, if a patient leaves, it has to come back within a certain period of time. There are fines and fees associated to that. So it's very important to see which patients are doing what and when. And finally, just for the purpose of the sample, I wanted to show how to take unstructured data or social media data. In this particular scenario, I've selected Twitter analytics, and the topic of selection was during the vote for Obamacare. I just entered the hashtag Obamacare, and I wanted to see which were the biggest mentioners of Obamacare, both positives and negatives, as well as who were the specific tweeters. So we find interesting that within a certain period of time, from April 12th to April 19th, the time of the vote, some of the biggest tweets were done by Fox News. Big surprise, as well as from the Barack Obama group, when they're showing the different mentions of Obamacare within that group. So Obama is very tweet-centric in terms of understanding the power of this media forum. So he was very good at counteracting the information that was presented to him. The purpose of this is not to say pro or con, but I just want to show how that information gets positioned over a map using the same technology with Power Map. And the query name was simple, hashtag Obamacare. In here, number of tweets per day, and you can zoom in or zoom out as you deem necessary. But the interesting thing too that you can do if you're a marketing group or somebody providing services to a hospital is you are taking a look. We had 1.8 million tweets on that particular period of time that we measured. So one of the interesting things we like to do is we like to understand who the person is tweeting. There are people who are professionally paid tweeters that have a lot of followers, or that they are influencers, as we call in the market. So we looked at this AFP of Michigan. They're from Lansing, Michigan. They have 7 tweets done. They have 1,302 followers. And this is the popular hashtags: Obamacare, Medicaid, no expansion, Michigan. So we know that this guy's probably fraud. We have another end user. And then American Populace. I'm not sure what those are represented, but they have 36 folks. They probably created something like this. And just to give an idea, it's taking, because Twitter it's an open-based source information. There's a lot of data about the end users. And if you want to query that, you can effectively go back and look at the date and the actual tweet from the standpoint of the presentation in there and see how it all works together. This again concludes our presentation for the healthcare analytics part, hosted by Microsoft and Marcello. Feel free to call if you have any questions. I'll be happy to present or go in depth into any of those details and show you how that information was collected and picked up. Thank you very much.